Okay, while we're waiting for more questions, I would like to reiterate that the essence about the bunion deformity is that, first of all, it is a condition of normal bones displaced from their normal position, and that the problem is not in the bones, but the ligament. Ligaments need to be corrected to not only restore the normal anatomy, but also function of the foot. And this second essence of the bunion condition is about the surgery, because the bunion condition actually affect the foot function, mechanical function of walking than anything else. So the surgery, it has to be proven capable of restoring function of the bunion foot. Then it will be worthwhile doing that. Okay, now I would like to introduce our guest today, and she is Pamela. Pamela, I know that looking back at my chart, you had your right foot bunion surgery in 2015, and before left foot. Sorry. Okay.
There we go.
Okay. And you had also your right foot bunion surgery by the traditional bone breaking technique about 12 years earlier,
Correct.
in 2003.
Yes.
And I think our audience would very much like to know what, first of all, what your feet problems were before any surgeries, and also how they felt after each surgery
Sure.
by different feet.
Sure. Happy to share. I've had bunions for many years. I was equestrian, so I rode horses from the time I was young. So over time, I was little, the bunions formed. So it was that ligament issue that you talked about earlier. So mine was kind of a sports-related injury, basically. And by 2003, I was in so much pain on the right foot. I had both bunions, but at that time, the right foot was the most painful, and it would wake me up. It was very, very significant.
Because the inflammation of the person.
Very much so. I lived in Michigan at the time, in America, so I had to wear closed-toed shoes. So it was uncomfortable all the time. So I had the bone breaking surgery, which at the time was really only discussed. You really didn't hear the newer procedure. And they certainly tell you that it's going to be a fairly quick procedure and you're going to recover quickly, but it was a terrible recovery. I would say a year. They said 3 months, and I would say more likely it was a year before I could even say I didn't have pain all the time. So it was very significant, very, very painful.
So how did you walk at that time?
With a little pain at the time.
Okay, and did you use the crutch or cane?
I used the cane a little bit in the beginning, especially. Yeah. I limped a lot, and I could not wear nice shoes for a long time. It did look better, and ultimately it did heal. And as you know, it still looks okay.
Yes.
But it was so painful, I swore I was never going to.
Yeah. But then you moved to Hong Kong.
I moved to Hong Kong in 2010. Yes. And by 2015, I couldn't walk again. The left knee.
So bad. We were looking for people or surgeons to deal with the left foot.
Yes.
And and from there on, you found me.
I found you.
And you trusted what I told you about the differences in no bone cutting technique.
Yes.
And so thank you for trusting us and trusting the surgery. And so how did you feel afterwards? How different from your first surgery experience?
It was very, very different. Right from even the experience in the hospital, by day 3, I wasn't feeling nearly as much pain as before. And doctor was really good about explaining to me, Pamela, you're not going to have as much pain as you did before. You need to be careful. And he gave me very explicit instructions, how many steps a day, what to do. And I'm very glad he did that because I might have been nodding because I was
Yes. You were not feeling much pain.
Nothing
You could
compared to-
walk. Yeah,
Mhm.
so it's possible, yeah, for patients, not intentionally, but unknowingly walking too much, and, may undo surgery. Yeah, for the
Right.
foot.
But I was good and I did everything Dr. Wu said. I was back in my trainers, tennis shoes for Americans, trainers here in Hong Kong.
Yes.
Within 3 months and doing some exercise, dragon boating, spin bike. I definitely, it was a completely different experience. I was
Good.
very, very grateful to find you because I swore I'd never do it.
Well, I'm glad I could help you, and also after 2015, you stay in Hong Kong,
Yes.
so that you to come to our talk today. I really thank you for taking time out to do this.
My pleasure.
And,
And thank you for helping.
Oh, it's actually a whole pleasure. Now there is another question in Cantonese. I will answer that first. Please. So 大多數嘅個患者咧問題咧係咧，如果嗰個做過我哋嘅手術一隻腳之後咧，另外一隻腳咧係唔係會咧係受到暫時咧受到影響咧？就基本上咧我哋嗰個人體聯合術咧，因為唔需要自然骨，所以咧做完之後咧冇乜痛嘅，第二日咧都可以行得啦，都行得嘅。然後咧，梗係咧，可能咧生理上咧，病人咧會就住一邊啦，但係咧就基本上係冇問題嘅。我哋手術咧都可以雙腳同時咧做埋一樣咧，嗰個復原嘅嗰個情況咧係冇分別嘅，都係咧我哋要限制患者病人嘅嗰個衡量啦，同埋嗰個復原嘅期咧都係一樣，一隻腳兩隻腳都係復原一齊復原嘅。So the question was that if the surgery was done on one foot, would the other foot be affected by trying to alleviate pressure on the operator side? Actually, after our surgery, because there is no breaking of bones, so there would be very little pain, and almost every patient in the first post-operative day could already stand and walk on the operating side with the full weight bearing. We don't mind, patients put all the weight on their operated foot, except not to walk too much, because if, like I said, we said before that without pain, and the people may unintentionally walking too much, and also we do many, as a majority, the cases of 2 feet, both feet at the same time, and the patient the next day will also be able to stand and walk both feet with the full weight bearing. So whether you have one foot or both feet done at the same time, you recover it's about the same. And so the question is that what happened to the extra bone that has formed on the side of the bunion protrusion? Yes, indeed, the protrusion that you see from outside actually is formed by bone, but that bone is mostly the normal part of the first metatarsal head. The extra, yes, there's always extra bone formation, and we do shave shave the excess or extra bone, but not part of the normal metatarsal bone to help reduce the bunion deformity。嗰個啱啱嗰個問題咧就係咧因為咧嗰個冇囊腫啊，就係咧係拇指側邊啊突出嚟嗰塊骨，我哋咧將嗰個第一隻骨拉翻直之後咧，可能咧一樣都仲可以 OK 感覺到嗰個多餘嘅骨但係咧我哋咧都如果有多餘嘅骨，我哋都會咧將佢批咗嘅，唔係截斷骨，只係批咗嗰個多餘嘅骨。
How long shall I walk normally again after the surgery? Maybe the patient to share with the story.
How long
Okay,
before
yes,
I walk so
Panama.
normally? Well, I guess normally is an interesting word. I could put my normal shoes on in 2 or 3 months, but really they give you a shoe that's open and has good support. So I was probably walking normally, I would say almost within a week. I was pretty careful in the beginning to baby it and keep it up, but you walk normally pretty early on after the surgery.
So what actually I always tell my patients that walking after surgery almost any time will not be a problem. The problem is actually the patients may start walking more and more because they can't do so without pain and to a point because our surgery afterwards relies on the sutures that we used to hold the first metatarsal straight from with the second metatarsal. So that those sutures have limited strength. If one does walk a lot, can loosen them up or even breaking them. So that's why afterwards we have to limit the patient's amount of walking to basically about 3,000 on average, 3,000 a day. And sometimes yes, one may walk less and sometimes you walk more, but even more, hopefully not over 5,000 steps a day.
And some audience ask that what is the percentage of the recurrence between the surgery?
We call this procedure a syndesmosis procedure. Syndesmosis actually means a normal structure in the body where it's like a ligament holding two parallel long bones together, like our tibia in the leg, the tibia and fibula has such a structure to hold the two long bones together. So, so the surgery is try to induce body to form this ligament between the two metatarsals, and this will happen because it's it's a condition that we create so to kind of let the body knows there is a trauma there, and the body will form what's basically the scar tissue to hold the two metatarsals together to prevent them separated again. And so the formation of this ligament will take time. It will take time. All depends on what you need to do and how much the strength of the ligament has formed. Basically, for this brand new ligament to heal fully, to reach its full strength, and so that ladies can wear high heels, dancing high heels, or anybody wants to run marathons can do so only after 6 months, which may sound kind of long, but any athlete would know either themselves or their friends who had cruciate ligament tear in their knee, then they will be pull out for at least 6 months, possibly 9 months before he can go back on the field. And so we have not had any recurrence after 6 months when the ligament has fully healed, fully established. But before, okay, that 6 months, during this first 6 months, if the patient kind of impatient and walk too much, may loosen up the sutures and may have partial, very, very rarely would have a complete recurrence of or complete loss of the correction, but partially, just a little bit. That's why the patients are followed up every month for X-ray to see if there's already some sign, usually mild sign of loosening. And by then, well, if that's the case, then of course the patient will be worried and will be very, very patient and good in following my instruction.
Don't be naughty, do what he says.
Yeah. So so for the first 3 months, we limit the walking amount to 3,000 steps a day, and for the fourth month is a transition period where the patient will walk back to normal. The fifth and sixth months there's no restrictions in walking except speed. There's no fast walking, like tall walking or running or jumping until 6 months afterwards.
Some audience are confused that will occur painful after doing the surgery. How do you feel
How
after
did
the
I feel like
surgery?
that
Yes.
day? I mean, it's a surgery, so certainly you have sutures and things have moved. So you'll have some pain. It's not unbearable, and you take your normal pain medication. But again, compared to the one I had in 2003, it was much less significant. So yes, you're going to have a couple of days of discomfort. It's not overwhelming. It's pretty easy to manage, especially as women who have children. It's nothing. So, but you'll have a little pain in the first couple of days. It is a surgery, right?
Right,
I mean,
sure.
we're not going to lie and tell you, oh, you're going to be happy and it's going to be perfect. But the doctor took good care of me and a little bit of medicine. But again, by a couple of days later, just such a big difference from the other one. So it'll be fine. It was worth it. I mean, if you have a bad bunion and you're in pain all the time, it was where I wished I'd done it sooner. And that's my only regret that I waited.
For any possible post-operative pain during the same day of the surgery, we routinely order Tylenol #1, okay, which is a mild painkiller for patients. And Pamela, did you need any stronger medicine than what they gave you?
At the hospital?
In the household, that's right. in the
No,
household,
no,
The first day after the surgery, yeah. And usually the first, or the day after surgery, we stop giving them painkillers regular basis, but only on demand. And Pamela, do you remember the second day, the day after surgery, you required any pain medicine?
I don't believe so. I
Yeah.
think it might have been
It's-
normal Panadol or nothing major. So it was much better.
And I can say that 90, 95, 98% patients by the day after surgery already they were not asking for painkillers because the pain would be mild, and of course often just associated with the walking. Yeah, but still it's tolerable and still can walk and no additional pain medicine.
You did not break any bones. You just
No.
moved it, right? That's
That's
the right one I had broke, two bones they broke. And the left one, they just moved it. So really, if you think about it, it's not as big of a surgery as when they break it. They're just moving it and you have to deal with that until that ligament grows, and it's not that big of a deal. If you
Yeah, that's right. We just shift the bone in its entirety break it, when you break it, it's almost like people who fractured and broke their bone, and that can be painful.
Some audience asking for, just to confirm, I'm able to do exercise as long as I do not put the pressure on the feet, and this will not loosen the suture.
That's quite true. That if you can avoid putting weight on your feet, then whatever other exercise you're allowed to do. For instance, all sorts of floor exercises, or doing the weight machine sitting down in the gym, and of course then not bicycle yet, not cross trainer, not treadmill yet. Later on, yes. For the bicycle, probably the 5th and 6th months one can work that.
My trainer, I had a personal trainer and I started back at the gym. And she just did a customized workout for me where you had different benches and weightlifting. You can do it without. I didn't get in trouble, so he didn't. I came and everything was okay.
Okay, that's right. And, do you mind if we show audiences your X-rays before and after? Yeah. Okay. Yes. On the top, our Pamela's photograph of her feet, and on the right is the X-ray before she had the syndesmosis procedure of her left foot. So for the photograph, you can see the bunion bump as a result of the first metatarsal. In the X-ray on the right, tilting outwards. Yeah, and our right foot had this the usual bone breaking surgery, and then on the bottom you see her feet. That was I remember 1 year afterwards, and now it looked pretty much the same as the right foot, except without initial push off the pain.
Right.
And on the X-ray, also you can see here. Let me just get okay. You can see that the first metatarsal, is realigned, corrected even more than her right foot after the bone breaking exercise. It is here. So what I was talking about is comparing the space between the first metatarsal and the second one, for left foot. So in other words, the syndesmosis procedure, not only actually Pamela's bunion condition, I would say, is was moderate, and we had much more severe ones, and they could equally be corrected by the simple suturing knee, and needed no break of any bones.
So, someone asked, even swimming is okay after the surgery?
No, because at the beginning, the wound needs about 2 weeks time to heal completely, and then the swimming is still kind of too much activity. I do not, I do not allow that yet. Maybe the 5th to 6th months, yes. 5th to 6th months, yes.